Hello, I'm Becky Dickman. I've been a retired nurse of 40 years in the Flathead Valley, mostly doing obstetrics, nursing, and neonatal intensive care. I worked with North Valley when they put in their Planetree program 25 years ago. Then, 20 years ago, I got my master's in nursing, creating a module for teaching Planetree in nursing schools. I traveled with the Planetree hospitals to see what they had done. So I went to the Dalles, Oregon, and to the Longmont, Colorado hospital. I noticed that the nursing stations had dining room tables that doctors, nurses, and families could gather for patient consultation. In Longmont, every floor had a chapel. The kitchens were on the floor where the families could prepare food and volunteers could bake cookies and bread to help with patient appetites. Children-friendly rooms and computer stations for families were also present. I discovered that Planetree is really different in every setting, but follows that caring module. So I'm kind of come full circle in working with Planetree from its early beginning in the valley. Planetree is a culture of caring. The roots of the Planetree start with the self, which is the most important part. What are the signals that your body gives you when it's time for a break? What kind of practices or spaces offer you the opportunity for self-care? Who is trustworthy in your life to help you recognize when you need a break? And it's important to remember that Logan Health has a mental health care program for employees, 6 mental health visits per year per problem. And who wouldn't want free mental health care? Relationships is another root in the tree, and it's based on one-on-one authenticity with patients and with staff. The team supports each other, whether work-related or not, and the patient is the center with a human interaction to move health forward. The department and the organization support the goals of the Planetree program. The trunk of the Planetree is patient-centered care. Planetree components have 9 branches putting people at the center of healthcare. Personalized care, not cure, but care. Patient and family inclusion in care and decisions. Co-design relationship of nurse and patient, share and learn together. The caring of culture, kindness and compassion, equality, holistic care, and value the needs of the patient and their dignity. The healing environment of the Planetree story is placement of desks so they are against the wall and not between the client and yourself. And the same way when you're doing a bedside stand beside the bed, keeping the area open between you and the client. There's plants and murals and other ways to make the healing environment comfortable. Leadership and governance, leading the healing process and relationships is important. And then data and technology is used as an asset to care and not as a replacement for care. Building healthy communities, sharing and caring for each other and communities. The workforce is self-care for nurse building, trust in relationships for self and others, as well as the patient. Florence Nightingale was the founder of nursing, and she used to say, "I don't pretend to teach her how to do it. I ask her to teach herself. For this purpose, I give her some hints." Thank you for indulging me in my current passion in life.